Okay, we'll stand and do the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This year is Mary Catherine.
Yes, thank you.
If Judge Curtis is going to be here.
I don't know. This was in follow-up in regards to the issue that was on the agenda last month. I tried to reach out to tell him that it had been resolved, but I wasn't able to touch base with
So
him.
is he just wanting to come just in case?
Yes.
Okay.
Yes.
So we're good with this, the insurance? is-
Insurance has covered it, so,
This is on the Agent Mark Ward.
correct. Yes.
Okay. I'll make a motion to adopt the agenda as presented.
Oh,
Support.
how did we skipped right over that, didn't we?
We just recovered nicely though.
Okay, good. So we have a motion and support to adopt the agenda. All those in favor, say aye.
Aye.
Against?
Aye,
Motion passed. So we'll just move right along then. Skip right over number one because we've already kind of covered it. Cynthia.
I did get an email from our prosecutor. She did have a hearing. She was hoping that it would be done, and she said she'll be here as
Kind of
soon as it's over.
Janelle.
Yes.
So why don't we just go right there?
I think that's an excellent idea.
Yeah. Because we're only 2 minutes into the meeting and you're already up to.
I love it. For April of 2023, we have revenue in the amount of $65,426.66. Expenses totaling $53,085.32. That was an end of month balance of $60,947.31. I think this balance sheet sometimes is, I don't want to say not accurate because it is definitely what the numbers show. But I just did a balance sheet report and I currently have 74,000 cash in the child care fund plus another 15,000 in savings. So I really have about $90,000. And this kind of looks like I only had 35,000 at the end of April. And I don't think that's an accurate reflection. I think some of it is those auditing numbers come in and out. So I think for next month, I'm gonna change the manner in which I present this. So you know what my actual cash balance is along with my savings. So you have a better picture and I have a better picture of where we're actually at.
So why do you think there's a difference? Is it because of the timing or is it?
Well, I think, and I can show you exactly what I think it is because I printed the balance sheet report. Don't mind if I come up. But this is exactly what I think the problem is, and I didn't understand this until recently. But my end of the month balance number, this here is always reported as this ending fund balance, that's 68,000. So this one's for May. So my one for April, this was the actual balance. But you've got like due from the state, 75, 72, 38. That number will stay the same all year, even though it's already come in. And same with this 30,000. That 30,000 is the liability. It's probably already come out, but it stays on my statement like it's missing.
Okay.
So this like 68 would be what I report, but you can see right up here, 74,000 is what my actual cash balance is. And then we still have the 15,000 in the savings account.
Okay. Okay, as long as you,
Does that make sense?
yeah.
Yeah. That's the way Kim explained it to me and I didn't understand it. So I think these numbers are more meaningful when you know what we actually have in cash and savings, if that is okay with this board.
Yep, that's fine. I've gotten so used to seeing this for the last 5 years or whatever that it'll be something new then.
Yes, we'll change it up. Numbers are good. We have a couple of kids in placement. You probably heard about the alleged kidnapper. He is being held at the jail. We are not paying for placement on him only because every place we called said absolutely not. The guy in Jackson County laughed at me and said, ma'am, even if I had a bed, I wouldn't give it to you.
Is it because of the situation or?
I think it's both. I don't think any facilities want the liability when you talk about kidnapping, kid-on-kid crime. I think facilities do not want to police some of that internally. At Oxford Shooter, he's being held at their jail, even though they have a juvenile facility, because the juvenile facility does not want the liability of all of that.
Okay.
We tried, we called Wisconsin, we called Ohio, Indiana, and everybody outright laughed at us pretty much, so.
Because you explained the nature of the situation and
It's always the first question, what's the youth in on? And nobody, I mean, CSC kidnapping is our first kidnapper, alleged kidnapper. Any sort of real, I mean, domestic violence is okay, but anything beyond that, when you start, assault with intent to do great bodily harm, they start wavering. And quite frankly, every facility is in a position where they don't have to take them. They're full no matter what. So
yeah.
why take a potentially violent, dangerous kid when you can get one that's a third of the trouble for the same amount of money?
Okay. Does anybody have any questions for Janelle?
Okay, thank you.
The Judge Curtis just came in.
Oh. So did you can come talk to us, but apparently we were told that everything is good.
If it's in regards to the insurance issue that was up last month,
Let me just get real quick then. Only because I learned of a new insurance issue, so I figured I might as well spring it on you while I'm here. So with regards to the insurance then for probation officer Marquardt, that's
yep, all resolved, all set, yes.
okay, because it doesn't change any, doesn't have to change his job description or anything. Okay, because that was the best we learned from some places by Detroit where their probation officers, if it was written in that they had to carry as part of their duties. So the other insurance issue, just while I have you here, and just learned about it this morning, is we had a person we were going to, well, the retired director from 911 was going to take our case management manager position with drug court. It's either a 20 or 30 hour contract position. So it's not an employee of the county. The county thus then requires you to carry your own liability insurance. And when you're only contract, you're not getting taxes taken out, it's kind of a part-time retirement job. He said that was too much. I'm not going to have to take on my own liability insurance to get into the position. So I don't know if that's where that liability, I've heard, anyways, I heard about it this morning. I've been on the bench the entire day. I haven't had a chance to look at it at all. I just figured, they said, come up here, tell them, so.
So is that something that you can kind of give us more information?
I would like to find out or what it is, or if is that one thing for, if you're putting up a tower and you have all these people over here, yes, you need to have your own liability insurance because you're your own business. But if we have independent contractors that are doing work through the drug court, is that somehow different?
Right now, the county policy is any independent contractor must carry their own insurance. I would have to go back and remind myself of the liability limits that are required, and they are different, right? If you're doing certain kinds of construction projects versus personal services, professional services, I would have to go remind myself of what those limits are, but that is the current county policy.
So maybe it's something I'll try to speak with, like I said, I just learned he turned the job. Last week I told he was taking the job. Today I found out he wasn't, haven't had any chance, but I'll try to then work with Mary Catherine to see if there's any way that we can do anything before come back in front of you. But like I said, they told me to come tell you guys, and that's what you got out of me. So can I tell him then probation officer Marquardt, is that going to go into effect?
As soon as you tell me it goes into effect, then we're good. Done.
Go into effect?
All right.
All right. So excellent. Well, great. And then hopefully we can figure out the other issue. All right. Thanks a lot for your time, everybody.
Thanks, Judge.
Thank you.
It looks like Cynthia made it.
Yep, so we breezed right over you, so I guess you can be up next, Cynthia.
Okay.
What do you guys, all you guys get off at 4?
Judge Curtis, I was supposed to go Slack across the street and
Just give you some.
probation violations, got a little winded.
No.
By you?
No, I literally just sat there. Those things. cash themselves out most of the time. So you have now received our final proposal from Carpel Solutions, or this was the software company that I spoke with this committee about several, I think it was maybe 2 months ago now. And since then, I was anxiously waiting, and after a little bit of a adjournment, the Prosecuting Attorneys Association of Michigan did vote and decide to go with this particular software company for their future endeavors. So with the cost proposal itself, we got a little bit of a break now that some advancements have happened. And there's, I believe, there's over 17 counties in the state that have already signed on and are actively working with Carpel. So that has worked out some of the kinks that were some extra expenditures before. So that's what led to a little bit of cost. I want to say savings, but the cost being somewhat less from the original proposal. One question Commissioner Osber had is what sort of increase have we seen historically in their annual rates? After asking them specifically, in the past 5 years, I believe it was, they have not had any increases in their rates. And a representative informed me that they have not heard of any increases on the horizon at this point in time.
And if I may, Ms. Muszynski, just to play devil's advocate for a moment. So what if we say no and you're going to have to stay with the current software that you have? What's the what if you would?
The what if is the current software will be shut down as soon as the Prosecuting Attorneys Association makes the full move over to Carpel. So there will be no more software for us to use. And just to remind this particular committee as to what we use that software for, not only is it to track all of our current cases that are going on, it's also to report them up to the state. So that way the criminal histories get filled in correctly, actual convictions are entered, and we build that history for the particular defendant. Otherwise, it would not necessarily get recorded. Well, I'd have to figure out a new go-between, really.
Okay.
Find a new software to record any of that up into the state. Because once we enter in the charges, then the courts are able to later enter in convictions and result from those charges into the system. But without our segment being filled in, the court segment can never be filled in either.
Yeah, ask another question there.
Yeah.
For sure. Okay. And I see in your letter that you addressed the leaders of all of the law enforcement agencies, city, our own county sheriff and the state police post commander have all endorsed and are asking for us to support this, as well as I see Steve, Mr. Musso back here. I don't know if he's here to endorse this with you because of the IT component of it.
Steve was asked to come and weigh in.
Okay.
His opinion, his analysis of things. I did have, about a couple months ago when I was actually out for COVID, my chief assistant set in on a group conference call. I believe Mr. Musso was there, if not Mr. Logan definitely was there to discuss additional details and what it would take and what sort of software things would be necessary and mandatory. Those are all outside of my vocabulary, unfortunately, which is why we had representation from the IT department there to ensure that this could happen and to feather out if there would be any hiccups in that data conversion.
Okay.
What do you got to add, Steve?
Just,
Yeah, come on up. Come on up.
yes, please. Yeah.
So from a networking standpoint, one of the things that I wanted to talk about was the concern that I had before this even came up, and that was that our network storage is really at a low level. When we bought the system recently in 2021, we had scaled it out for 5 years, and that was at a particular growth rate. Well, the prosecutor's rate changed dramatically in about late 2022. We had projected 15% growth, and they started running at 175% growth. And that, to a large part, as far as I know, it has to do with the body camera and the police in-car cameras and things like that that we're starting to do now that we didn't do before. In any event, at the rate we're going right now, we'll be out of space completely by July of this year. And that means everything, the whole network would shut down, which we don't want. So we talked it over, discussed what was going on, and come up with a plan right now that they're going to work on trying to figure out a way to reduce the types of things that they're storing, and also going to go back and look to see if there's any duplicate data to see if we can bring that storage level down. And if we can do that, the problem still remains that we've got a year before this program comes into play. So we've got, I mean, we're projected to run out of space in July, yet we've got till, I don't know when next year, but sometime next year that the new system's going to come online. So what we've come up with, I've kind of had a little time to work out some things behind the scenes that I was more concerned about this earlier than I am now. But along with the reduction in data, as long as we can achieve that, once they go to Carpel, then a lot of that data gets transferred into the cloud. So we don't have to, it won't be on our system anymore. So what we have is we have a plan now in place that if we get, we're at a level that's concerning to me right now. If we get much lower, because once we start working on this, if it doesn't dip to the point we should be, then what we'll do is we have a plan to move partially their data to another off-network server. That's not the right word, but it's not on the network storage. It'll be on another server. The difference being is that the network storage is built for resiliency and redundancy. The other side is not. So we would have a little bit more risk in terms of possible corruption of data and things like that. But we could do that temporarily while we're working on this to make sure that things flip over. And one of the things we have, we back up our data nightly, so that would kind of reduce that potential risk as well. So I'm looking at, just to throw a number on this, if we had to buy something right now, it'd be about $57,000 that we'd have to put into IT to sustain the kind of levels of data that they're running through right now. If we can reduce this, and then they take a big chunk of that data to the cloud, then we're fine. We'll be back to where we need to be. So there is some impetus for getting this in the cloud. I tried figuring out the levels of data, the amounts of data, and I really can't get a handle on it because there's too many unknowns right now. So to say that it's a totally not going to be a concern, I don't want to say that. But at the same time, I feel like we probably have more of a handle on it now than I felt a couple of weeks ago.
You said this Carpel goes online next year? They're looking at next year?
Well, they did give us a breakdown of the various months in which it would take to integrate our system, which was within the contract itself. I don't know if you guys have a copy of this contract.
The 21-page proposal?
No, it's a 32-page contract.
Oh, got the executive summary.
Yeah.
So, you know, the go live date is, they say about 12 months. It's between 6 and 12 months.
Okay.
It has to be free and clear and running the program fully on our own with all of our information.
So basically, last time you come to into the board meeting, Cynthia, you wanted the overtime to start upping some of that.
Yes.
Yeah. Open up some of that storage for yourself.
Right, so that's our plan. So we have roughly 6-ish weeks to accomplish that before the July Tuesday.
Sounds like the federal budget.
Yes.
Was not entirely true. Because in 6 weeks, we'll be shutting down to the point we need to be. But
What, I mean, why buy, what I'm trying to say is, we don't need another storage right now. If we can get this taken care of.
Yes.
But if we can't get it taken care of,
then we're going to need it.
yes, we're going to need it right away. What's the lead time and something like that?
Probably a month. by the time we get it all scoped out and they have to build it and get it sent to us.
So Logan set us up with a good plan as to what he believes will get us under that threshold. What we're planning on doing prior to July anyways is going further than that. So it can really buy us some additional time to get through, installation of any new software.
So the big question is, where's this coming from? Money.
Good question. So
So it sounds like you guys are working together, so half's coming out of his budget. and half's coming out of our budget.
the annual fee is one that will be a little bit discretionary, not discretionary, but variable just due to how much data we end up storing in the cloud. So we get a free 2 terabytes. Right now, with all of our data over the past probably 15 or so years, since 2012, I think we started using cross-shared. So 11 years, we're using 9 terabytes with an additional roughly 5 per year.
That's the rate we're going at
Yeah.
right now.
So if we get the 2 free terabytes a year, and then however much we use after that is an extra $1,000, which is roughly around what additional storage had been costing, I believe, although we've expanded that option at this point.
It's $1,000 per terabyte
Right.
beyond two terabytes that they included with it. So if we did it just the way it stands right now, without reduction of anything, the first year would be an additional $7,000 for the 7 additional terabytes. And then each year, if it continued, and I'm not saying it will, I'm just saying if it continued at the same growth it is right now, it'd be an additional $5,000 a year going forward.
Which is,
Why an additional 5,000?
Because they're growing at a rate of 5 terabytes a year right now.
No. Well, when I was reading this, and I highlighted this, and I guess I'm a little bit confused. It says additional storage after including 2 terabytes per terabyte per year is 1,000. And then the same thing, it says additional storage after including 2 terabytes per 100 terabytes per year is 32,000.
Yeah,
I literally asked Steve what
that's a
that,
little misleading. That's if you have 100 terabytes or more of data out there, then they've reduced the rates to 36,000, I think it was,
32,000?
32,000, yeah.
Yeah.
We're not going to be anywhere near that.
right, and hopefully with our new retention schedule, we'd be deleting stuff after, I think it's not 7 to 9 years, depending on the case. Anyway, so it would be more of a revolving storage than it is right now.
According to your letter, it says that the one-time price of $54,000, that's to buy the software, and then it's about $10,000 a year for the subscription for updated services, et cetera. So is that going to be the cost then, or is it above and beyond that?
That would be the cost plus the $1,000 per extra terabyte.
Okay.
Which is at the bottom.
So we pay 10,000 plus the additional terabyte or everything above that 2 terabyte?
Right. And our plan right now is to, again, shrink the amount of storage that we use by being more discretionary on what we download versus what we keep the email links for. Right now, we've had such exponential growth because all 3 departments are now using body cams as well as 1, if not 3 different views from their patrol cars, which we never had that prior to 2021. And so what we're hoping to do is to not only eliminate a lot of that video in cases that have been closed out, in cases that, where the appeals period is no longer, has expired rather. But also one of the departments, Alpena City Police currently uses a system, which is not WatchGuard, but it goes by a different name, but they can send us an email that has a link that never expires. So essentially the company that they went with houses all of the video and we can pull it from there at any given time. So we no longer, I believe, have to download that information, which is what we've been doing. So I think that the downloading and the amount of storage per year will go down quite a bit.
I know that, in my opinion, this is the price of doing business. To tell, Ms. Mushinsky, oh, gee, no, your office is going to have to figure it out isn't the right way. It's a lot of money, $54,000 to buy the software and then the $10,000 a year or so. But it's the price of doing business. I don't think we really have any other alternative. I mean, these 17 plus counties are already, and there's more, and then the Prosecutors Officers Association of Michigan, they've all endorsed this, correct? I mean, it's
Yes.
kind of the way we're all going.
Right, not every single county is going to go to Carpel, but this will be the one that is supported by the Prosecuting Attorneys Association. And so that's what that association will be working with. It also has two different systems on it, which would combine actually three systems that we currently have. So currently we use adult case tracking and juvenile case tracking. That's the piece that's going to expire and that we would have to replace no matter what. We also have a contract with Filer, which is a subsidiary of the Cherryland system. And Cherryland's used by multiple departments in the county, but the Filer system that we currently use, it does have a cost of roughly $3,600 a year. So once we moved completely to Carpel, we would no longer have that particular cost.
So you'll have some savings from,
A little bit of savings there.
About a third of the year.
yeah.
So what are the other 66 counties going to do if they're not switching?
They're either going to move over to Carpel, but there's some counties that already have a system that they use called on-base or star-based services. So they are going to try to figure out a way to stick with that service. I know that they talked a lot about that at the conference. I didn't really follow since I don't know that system very well, but that is one of the other systems that was voted on by the other prosecuting attorneys or the other prosecutors in the state. And this was kind of an overwhelming decision to go with Carpel based on its services and the price.
It kind of sounds like it's a choice between $57,000 for a new server or an investment of $54,000 in this software.
And the software, yeah,
That's kind of what I'm hearing.
an annual subscription or whatever we call it, yeah.
I ran the numbers just roughly for 5 years. If everything stayed the way it is right now, it is almost the same in a net. I mean, to do the network side of things would run roughly about $120,000 and about $156,000 with Carpel. And that's assuming we keep the same rates. But one of the things they said when I talked to them is that they're working on something right now that they think is going to reduce the rates for us on the additional storage anyway before we start the contract next year. So that'll probably come down. Plus they got the little bit of savings from the filer that comes into play. So that's out roughly in the same area. So even if we didn't go with Carpel, we're still going to be spending somewhere near that money.
I guess the biggest question, as I said earlier, is where's the money coming from? Because, $54,000, and I know we had talked last week or whatever it was, you have that position. How much is that position? Because obviously you had mentioned the position isn't filled, so you do have some money there. Could a portion of that go towards this software?
It isn't filled yet.
It's not filled yet.
Or even if it is filled, if it was filled tomorrow, there's 5 months that we haven't used that.
Agreed. But it's not like she's not going to fill it. That's, I guess, the
No,
point that I
and I
wanted to
get
make sure.
that.
Yeah,
Right.
okay.
No, that's a good point, Joe. I never think to use salary monies on non-salary things. I've been told to keep those totally separate. But, yeah, so the starting wage for assistant prosecutor is somewhere around $63,000. So even if we used half of that, by all means, let's do that. Other than that, I know that a lot of counties did initially use their COVID money for switching over to this type of technological advancement. That was when COVID first hit, and I think this qualifies, although I haven't read the fine print, for ARPA funds as well. Obviously, just a one-time expense.
You did say it would qualify?
That's my understanding.
We're already in the budget. I mean, the ARPA funds are already in the,
They're in the general fund. This
General fund,
is something that would qualify for general fund expenditures. And so, yes.
So just a couple quick things. One is, when you came to us in February, you said it'd be 85,000. we waited 3 months and we saved $31,000.
So you're saying, yeah, I get that.
That would be so great, but like I said, with the other counties signing on, they were able to work out a lot of kinks, like with the lien system and with fingerprinting, so that brought those costs way down.
I was just joking. So real quick, so I would say, I mean, the cameras for the police car is qualified, and I would assume that this would be a public safety measure that would keep everything in file. So if we don't have it anymore, you said then we just wouldn't have software, but then the plan would just be going paper and pen, basically. I mean, whole filing cabinets. What would, Mary Catherine, approximately what would be the total be then right now that we would have set aside from what we save on the salary? It would be.
I would have to run that report quickly.
Make it to next month, it would be half.
Well, I'm thinking if we were to use
Minus the
ARPA
2.
funds for the 54 and then use the salary money for 2-year prepay, and we'd be set 2 years out on the annual pay.
What we could do is take it out of contingency and find out how much money she has available, and transfer that back into the general fund.
When would the contract amount be due? Is there a down payment that you would have to
They
pay
said we could split it up into 2 years.
2 budget years?
Yeah, I'd love to re-review the actual contract terms. It was quite lengthy.
Right, because I didn't have that. I just had the proposal.
I'll email that to you as well.
Because there are a couple of options. One is obviously the equipment fund, which is a place that we put funds for equipment purchases. And this is software, but it stands in the place of equipment in terms of storage. So that would be one option. Straight from the ARPA fund would be another option, or if we can pull enough savings over 2 budget years, at least perhaps from this budget year to pay the first half of it from the savings on the not filling that position, we could do at least this year's portion from that, and next year's portion we could budget as part of the regular budgeting process, either through the equipment fund or through the ARPA fund.
And only because I was thinking about what the chairman's comment was, where does the money come from? So again, if we were to use ARPA funds for the 54, if we were to pull the money that's left over or that we haven't spent on salary and to gear 2 years ahead, that gives the prosecutor 2 years to figure out how to make those annual dues without us having to absorb that cost.
Yeah, I mean, typically we don't roll forward savings from not filling a position.
The money's sitting there though.
Well, it is right now, but obviously as we look forward to next year's budget, it all just is in the general fund. But I mean, it's certainly something we could look at. Just
I mean, we wouldn't be using that salary to increase.
right,
the amount
so
of
it's
staff out of it.
back in the piggy bank, so to speak.
We need a motion to go ahead
We
with
need
this.
a motion on something, right?
Yeah, if we sit here and look like a bunch of bumps in a log.
Right.
I'll make a motion, we go ahead and proceed, where are we gonna proceed with though, as far as,
Well, you can approve the moving ahead with Kaplan or Carpel, with a recommendation on funding after we've done a little bit more research.
Okay, that's a good one. That's
a
an
good
easy
thing.
way out.
That's an easy way out, yeah.
Motion,
Support it.
support. So any further discussion? So then all those in,
We're spending money. And now we're not spending money because
Not yet.
Yeah.
so we're just approving?
Yeah.
Okay. So all those in favor, say aye.
Aye.
Opposed?
All right,
Thanks.
let me know what else I can do to help out.
Come up with $54,000.
Bake sales at the Little League field. I mean,
I don't think it's for Lily.
there you go.
Okay. Juvenile Justice Ad Hoc Committee update, is that?
That is myself and Mary Catherine to support or supplement. So we've had 5 previous meetings of the Juvenile Justice Ad Hoc Committee meetings or tangential encounters, I'll call them, because we've talked about two things. One is we've had discussions on a local 4 to 6 to 8 bed juvenile detention facility to be used for short-term detention, consequence actions, et cetera, by our probation officers. And then a parallel track of this regional juvenile secure residential treatment facility. So the last meeting was on May 7th for this coalition on the regional residential juvenile treatment facility. Members present, there were Gladwin County had 4 representatives, Alpena County had 2 reps, Crawford County 2 reps, and Roscommon didn't show, along with Ron Colvin from the Banro Corporation and Mr. Goldman from Goldman Architects were there. So I'm just going to cut to the chase. In my opinion, it looks like this coalition is possibly dissolving because of the lack of support from the state of Michigan, it appears. And that, again, Roscommon, they just didn't show up, and they were one of our 4 county coalition members. Gladwin County was, their representatives were basically, they said, look, their judge isn't going to put anybody into a long-term facility unless they're made wards of the state under Public Act 150, where the state takes control of the juvenile and places them somewhere. So from a county perspective to be utilizing it, they were not optimistic that their county, their judge in their county was going to support this type of facility. So the next action, based upon about an hour or so of discussion, was that the Goldberg Architectural Group was going to go back to look for a new option of maybe using short-term versus long-term placement to try to lower the costs to $200 a day for the per diem, because right now it's at about $290 a day, $290 a day is their estimate on their per diem. So that coalition meeting to look at the regional facility is moving ahead, but moving ahead very slowly and with some I will say some pessimism. Mary Catherine, please, if my pessimistic view is too pessimistic, please, add to what your observations.
No, I think I might be a little bit more optimistic, but I tend to be a glasses half full rather than a glasses half empty person anyway. Yes, I think the information from, one of the partners in regards to the long-term incarceration, the long-term sentencing, was a little bit disheartening because they said essentially, look, we'll never fill any beds. So us being here is kind of pointless. So it turned again to the discussion about more, how do we handle short term? But long term is where there is a funding model to make it work, whereas short term, there is not as much of a funding model, because if you're just doing short term stays, the draw of having a regional facility isn't as much. Like if you're really just, putting a kid in for a consequence for 72 hours or something like that, having a big fancy regional facility isn't really worth it. There is still very much a need, and I think it circles back around to a discussion, and maybe it's broadening it back out to other counties, because clearly within the state there is a need for this type of facility. The feeling even in the room of the people who were there is, if you built a 42-bed facility or a 36-bed facility and opened it up to the general public, which is to say the other counties in the state of Michigan, we'd have it full in a hot heartbeat. But you still have to have a couple of counties who are willing to put the skin in the game and commit to building it in the first place. And so.
We were at the MAC conference, and Bert and I sat in the juvenile seminar, and somebody asked the state if the state was interested in building regional facilities, UP, Northern Michigan's He says there's no way in age that we're going to build a juvenile facility.
Yeah, Mike was from Gladwin. He was at this meeting with us. The guy who asked the question, so.
He said there's no way they would build a regional facility. So
Who is Mike?
He's one of the commissioners from Gladwin County.
He said there's no way that the state would.
know that.
The state director, Elizabeth Hertel, said that. So it was very curt and very adamant. No, the state is not interested in supporting and developing any kind of a regional detention facility in Michigan.
So if they're not willing to support or develop it, then it's stuck or pushed back onto the counties.
Oh, yeah, they'll push it back in the counties.
Then how do we cover?
I think the discussion with the state is probably not, are you, the state of Michigan, going to build these? But perhaps the question is, if we, the county or a coalition of counties, build this, will you commit to a contract with us for housing youth that are wards of the state? So it seems like that could be another avenue to get into this. Whereas if they say, yeah, we'll guarantee that we'll, rent, lease, take 20 beds of this facility from you to house kids that have been adjudicated and are wards of the state, because they are just as desperate as everyone else for bed space, as is DHHS, which is another conversation. So DHHS, which are not kids who have been adjudicated, but kids who need placement because of treatment or, behavioral health or mental health needs. That could be another discussion, is another place to fill the beds. Because essentially, what we're trying to do with this facility, the funding mechanism that has been recommended, that has been suggested, are revenue bonds, so that this isn't carried by the taxpayer. That being said, obviously, if you are going to do revenue bonds, you have to show a guaranteed stream of revenue to pay the bond. So that's what they're trying to get to, is how do we guarantee that stream of revenue in order to pay the revenue bonds to build the facility?
And Goldberg's estimate is that to build this for 82 beds is about $29 million with an annual debt payment of about $1.75 million is what they're looking at. One of the other concerns that was discussed, and I don't have all the details, apparently Sheboygan had built, and maybe Jesse, you have a little more awareness from Sue Aller, but Sheboygan was has built a juvenile facility, but the state has now, I don't know if renege is the right term, but the state is not going to license them. So they've this facility built and it's not being utilized for a juvenile detention facility, but I need to follow back up on that. Do you recall any of that conversation?
No, I don't.
Okay.
Sorry.
Yeah, no, that's okay. But I wrote it down with a double asterisk. I thought there's concerns about the state backing out of the Sheboygan juvenile facility after approving and supporting the construction. So I have to follow back up on that. That's still a task for me to follow up on. And maybe we have Janelle, maybe she has some awareness there. But that just seemed to be a bit of a concern. And what happened, how did that happen? But going back to, so that's kind of where we're at with the whole regional long-term secure treatment facility. You can't say detention anymore, apparently. So it's a secure residential treatment facility for juveniles, something to that effect. And as Mary Catherine said, they're going to go back and look at for short-term placements using this through Banro and Goldberg Associates, and they'll come back in the next couple of months. But just an opportunity. I see the sheriff's here, after this recent arrest of this 17-year-old for an attempted abduction of an 8-year-old girl. It probably points to the need to have a juvenile detention facility here, 4 to 6 beds are what we talked about, again, that on that other parallel track, because we have a case in point right now going on, and, the sheriff can tell us what they've had to do to accommodate this. If you don't mind, Sheriff, put you on the spot.
No, so, yeah, having a juvenile in there really impacts our operations, sight and sound. We have to keep them away from adults. And the site right now, just because we're low on numbers, is pretty doable. And you guys probably saw that when you walked through the jail tour. But the sound, obviously, you're not going to completely get away from that. We're doing our best. I think we are within the guidelines, but like I said, it really hampers our operation. And like I told most of you before, with the murder trial coming up and having those individuals back in our facility, it really is going to hamper those operations, trying to keep 3 people separated plus a juvenile separated. It just makes things difficult.
Okay, thanks, Sheriff. So, again, with that case in point, we think we have the need for, a 4 to 6 bed facility, but we've talked more about the need, but we haven't gotten any closer to figure, okay, how do we fund or first of all, how do we fund it? And then what's our design plan to actually build it adjacent to the jail so we haven't really gotten any further on that. We still know there's a need, so.
So what's next?
Well, right now, we're waiting on what happens with this Goldberg group to see if they come back, to see if they offer anything for short-term placement, because maybe that will fulfill our need. And maybe there's a way we can get the per diem rate and figure that out. But what's next is, quite frankly, I don't know. I'm not an expert. Our juvenile experts aren't here right now. I'll follow back up with them and see if we seem to just be kicking the can down the road without putting it through any kind of uprights. So I don't know what our end state is for this juvenile justice ad hoc committee. There's a need, but what's the next step is to figure out, we would need a design and then how to figure out funding. And we're not there yet.
Janelle has the grant application in for
Raise the age.
Raise the age.
And we've heard nothing back on that last report.
Okay,
So sorry it was so pessimistic, but that's kind of the way I calls it like I sees it.
okay. So moving on to the next item, looks like Fire Chief, proposed fee changes.
How's everybody today? Hey, Catherine, did I send you the memo that I had sent to council?
You did not. I just was going back to see if I could find.
Can I give that to you?
Yeah.
You okay? I'm actually going to give you 2 documents to start with. This is actually the letter that was sent to council requesting the fee increase for you to read, and we'll go over that. The second one is actually going to be what the proposed fee increase is. You see some of the items on there, we did not change the fees at all. So all this came about was every year annually, we review our fee schedule for what we charge for ambulance services for our transports. And in talking with our EMS billing provider, Mobile Health Resources, they actually suggested that we update it annually as we're kind of behind the 8 ball on a couple of things that we do as far as our charges for ambulance services. Third-party insurers like Medicare, Medicaid, and Blue Cross establish allowable fees for ambulance service and publish those revisions annually as they change. Basically, by not adjusting our rates and underbilling, we're essentially using tax money to subsidize commercial insurers' profits, and basically leaves us with less revenue to operate from. So any allowable increase assists in our long-term sustainability to provide key essential EMS services to the community for the future. Basically, it's about cost recovery. They set the standards for what we can bill for, very tightly regulated. One fee that was suggested that we had is a treat no transport fee for patient refusals. We're getting a lot of those that we currently don't charge for. Now, there's a difference between the treat no transport and the patient assist. And if I can elaborate on that a little bit, patient assist, we have a fee in there right now for $175, which allows us that we could charge people for assist. Basically what that is helping somebody get from the residence to a vehicle back into the residence, like to go to a doctor's appointment. We don't charge that right now because most of the people that we're doing those on, they're a very elder population. They're 70, 80, 90 years old. They just need help getting in a vehicle is all they need. And there's no need for them to go by ambulance. Just as a number, so you know, last year we basically took a snapshot of 1 year ago when I actually devised this for city council. We had 141 of those were patient assist that we don't bill for. And we have that in our fee schedule, but we choose not to bill for it because these people are very elder, probably don't have much for insurance and are on limited income. One thing that the billing agency cautioned us on is if we were to charge for patient assist, You can't pick and choose who you're going to bill for when it comes to ambulance billing. You bill one or you bill none. So that's why we've opted to stay out of the patient assist. Now, the only thing that we do have the option on, that we do exercise, we have had patients that need assistance getting in and out of the car twice a day, 3 times a week, for 6 weeks at a time. That takes a considerable amount of resources. And we tell them up front, we are going to charge you for this, because it basically means that we have a dedicated appointment that we have to be there at 10 o'clock in the morning to help you get in your car or to get into dial-a-ride. And we have to be back at 3 o'clock to do that. So a lot of resources in that. So those ones we are allowed to charge for because they're recurring. However, we don't charge for them as of right now, but we do have that ability to be able to do that. One thing in the bottom, you see public assist and treat no transport fees. They don't qualify for the $200 county resident discount. The discount requires transport to the emergency department. That's the only way you're eligible for the discount. So there is no discount for that. If you go to the second page, I basically broke down the table as to what we currently charge for our rates, what the proposed charge for the new rates would be, what that difference is, and what the percentage and change is. Per our ambulance contract, anything over 5% requires you guys to kind of give your blessing along with city council. The only one that is above that 5% is the basic life support base rate. That one's at 5.2%. All the rest of them are 3.4, 2.6, 2.9. The ambulance standby for profit events, that is something we opted to increase that by 25%. We've had considerable amount of increase in salaries, obviously. So for us to put crews there and have them stand by, and this is for a private event. So I'm going to use an example of the rodeo if they brought it back to the Aplex. If they have a dedicated rig that needs to be there for 8 hours, they have to pay somebody to be there and they have to be dedicated to that event. That's a paid event. So we would charge them the $125 an hour instead of the $100. So we did increase that by 25%. So the only new fee to this is the treat no transport fee. And part of the reason we're doing that as well, we're getting a lot of those requests for treat no transport. We do have, we still have to provide care. Every time we get called out to do an EMS call, we still have to respond just like it's any other call. We don't have a just check you out call, if you will. So it's a fall without injuries. It's a fall with injuries. It's a car accident. It's a car deer accident. We do get canceled on a major number of those. For all the treat no transports that we had throughout the whole system in 1 year, there were 777 treat no transports. Of those, 141 were the assists that I just talked about. There was 267 of those that we got canceled prior to even making scene. So first responders got there, law enforcement got there, patient said, I don't need any care, it's just a car deer accident. We get canceled on those ones. The ones that we're looking at are the treat no transports, where we basically feel that they need to go to the hospital, they need some advanced treatment more than what we could give. There's about 253 of those per year that we have. So that's the fee we're looking at covering. The insurance billing company that we work with, they said that is definitely an acceptable fee to charge people. Basically what happens is their insurance is going to pay it whether we transport or we don't transport. So you're talking car accidents, you're talking any type of Medicare, Medicaid, that would cover that fee just like as if it's a transport. We do have a protocol when we go to do patient care as far as refusal of care. And it's pretty lengthy as far as what we do as far as treatment before we grant a refusal. We really are advocates for the patient. If we go there and we think that there's any question at all that you should go to the hospital, we're going to try and be an advocate and promote you to go to the hospital because of the medical condition. We could turn around and walk away and they could go into cardiac arrest 10 minutes later. If we can't convince them to go, that's on them. That's why we do try and get as many people to go as we can, because we can't see and do everything else. So.
Well,
questions?
yeah. So out of all the costs, that's probably the only one that I personally have an issue with. So I was thinking about it. If you go to how does this work if you show up at an accident and someone doesn't have insurance?
You're treated like any other call. We would bill them.
So then they would get the bill for the 250 bucks
250.
or whatever, well, plus, right?
Nope, it'd just be the 250. If they refuse treatment or transport, that's all they would get a fee for. They would just get assessed a $250 treatment or transport. if they had no insurance. And the billing agency would treat that just like any other call that we have where somebody doesn't have insurance. They try and work with them as far as a payment plan. And eventually, if they have to, either A, it goes to collections, or B, we write some of that off. We actually only collect about 80% of our actual total charges that we bill out. Because there's some we just don't capture.
So where does it fall in where there's an accident and somebody involved in a single car accident, not a multiple car accident? I didn't call you. Somebody else called you.
So for us, that's no patient contact. Because if nobody called, they did not call and they say, I do not want an ambulance, I do not want any treatment at all, that's a cancellation.
Okay.
So it's not a treat, no transport. If I come up to you and say, hey, I'm with the fire department, with the ambulance, I'm here to make sure you're okay, and you acknowledge and you accept the care, that's a treat, no transport.
Okay, it's a treat, no transport. Okay.
But if you deny it, if you say, I want no care, I don't want you to touch me, I don't want a blood pressure, I don't want anything, that's a cancellation, that's a no patient contact.
Even if you're there, even if you drove all the way to the scene and they,
If somebody else called, for example.
Yep, if somebody else calls.
because that was my other thought too, was, and I don't know, probably the same thing as he had, that if I'm whatever and you show up and I'm like, I didn't call you, I don't know how this happened. I'm good, I don't need any assistance.
Yep, they can decline it. It's a no patient contact. I'm going to give you two more pieces of paper if I could, just so you have it for your reference. One is our treatment protocols for refusal of care for an adult and a minor. Just so it just gives you a little history, is all it does. It doesn't change anything we're trying to do. But it binds us by medical control what our requirements are in order to grant a refusal. The second document I'm going to give you is actually our patient refusal form that you can just look at. So it's more than just showing up and saying, yep, I don't want to go to the hospital. We have to do a full patient assessment on them, including vitals, blood pressure, pulse, 12-lead EKG if it's warranted, lung sounds, basically baseline vital signs. So that when we leave there and we advise the hospital that you don't want to go to the emergency department for care, it's documented that we did try and get you to go. Somebody signs as a witness that you do not want to go. It takes some of the liability off from us.
So there's a difference. So the two things are cancel, no charge, refusal, there's a charge, but you fill out this piece of paper.
It's a refusal as a treat, no transport.
So if I have no insurance and you show up and I'm thinking to myself, I can't afford this. And again, I feel good. Obviously, I'm not going to say that if I got an issue. But at that point, I can cancel it and you're not going to charge me anything.
Correct.
Okay.
Correct. We get that now even with people who do call, because we go there and they're like, yeah, I feel fine. I don't want the bill. We don't worry about the bill, to be honest with you. We're more involved in the patient advocate side to try and get people, yes, you should go and be evaluated no matter what the cost is. But there are people that say, you know what, I don't even have $100. So
I know how I am. I'm a guy, right? My wife runs downstairs and she calls the ambulance and I jumped up off the floor from passing out and I ran down the stairs. Do not call the ambulance. I'm good.
and she still does.
Well, she didn't, but I'm that person. I'm like, do not call, I just passed out or whatever, bumped my head. Like, do not call. I'm good. I never get sick. I never get hurt. I don't need anybody's help.
Right. You have that right to do that. And you have that right to do it as long as you're alert and cognitive. That's why I gave you the protocol.
Yeah.
Because if you're under the influence of drugs or alcohol and can't make the choice on your own, then I can't allow you to get a refusal.
Well, that would make sense.
Yeah. So we really do try to be a patient advocate, that we want you to go get evaluated, especially if we think that there's a good reason based on mechanism of injury, or things that we're seeing, your vital signs, for instance. If your blood pressure is 80/40 and you're pale and sweaty and you can't stand up without passing out, we really want you to go. However, if you're alert and cognitive, we'll call the hospital and ask for permission or direction of what they want us to do. And they may say, you need to convince this person to go or get a family member to take them. We do that as well. Somebody doesn't want to come with us. Okay, you don't want to come with us. Would you be okay if your wife takes you up to the hospital, your son, your whoever, and we'll help them get in the car? There's no charge for that. Because if they don't want care, we just want them to get to the hospital.
So you kind of made a comment about costing the taxpayers without this increase. So what is that number? What is this number going to be if you think, I'm sure you probably had some calculations, rough estimates, what is the calculation of,
Based on last year alone, it would have generated just under $64,000 in revenue.
well, that's the,
No transport.
yeah.
Yep.
So I'm saying overall, because you mentioned that this is costing the taxpayers without these increases. So when was it just the 64,000, or what is this extra revenue that will be generated with the increases of all these others as well? Did you calculate that?
I didn't calculate that. Didn't calculate that as far as what it adds to the actual revenue side of it.
Yeah.
The only thing I basically computed what the revenue would be if we transported that amount of patients, the
253. Okay.
That's what it would add as far as revenue. Now, if we transported those 250 or 253 people, it would generate approximately $112,000 if we actually did the transport. And where would we use that? I mean,
With that now, because
I don't,
well, the calculation, 253, 20, whatever it was, 250,
250, yep,
into 63,250.
correct. And if I transported somebody at the basic rate, at a basic life support rate at $525, it would generate $112,875
Okay.
if we transported. But again, we're not doing this so that we can generate transport.
Yeah.
We're looking to make sure that, obviously the costs are covered. It costs us money every time we put the ambulance out there. And if we do a treat no transport just because somebody doesn't want to go to the hospital, we're not looking to make this into a cash cow or anything. It's billable revenue that we're leaving on the table.
And you said that currently right now, the city is generating these bills, or who generates the invoices for?
The invoices come from Mobile Health Resources. They're a billing company.
Okay.
What is the ask today?
So the ask for today, if you go to that back page,
What's the document?
of the one for city council, one for city council, that is the proposed changes. That is the proposed fee schedule that we're looking at increasing those amounts or establishing those amounts.
The only three you really would need our approval on is the basic life support base rate, ambulance standby, and treat no transport.
Yeah, the ambulance standby one you wouldn't need because it's privately contracted, if you will. So it doesn't affect the insurance. There's no insurance coverage for that at all. That's just for a private entity if they need absolute coverage.
And I apologize and I believe this is what the chair asked, but I just want to make sure I understood it correctly. He was asking, there is no math to show actually what the total would be with these new fees integrated. What the total would be?
No.
Okay.
No, correct.
So there's really only two services, the basic life support base rate, because it's 5.2% change.
Yep.
And the ambulance, the treat no transport, the new fee of 250.
Correct. The rest of them are all under the 5%.
Under 5% threshold, so we don't need any action on that. Okay.
And basically what those proposed changes on everything except for the treat no transport brings it up to what the Medicare and Medicaid standard is. That's what's currently being built.
So that's what their current rate is?
That's what Blue Cross Blue Shield or Blue Care Network, Medicare and Medicaid, that's their allowable expense. So if I go to bill for ambulance service, that's the maximum amount that will.
So just to go back to my original question, if someone, and again, I'm making assumptions here, but if you run in out of those 253 people that you could have transported, let's just say even 10% of them didn't have insurance. You mentioned 80%, you only collect about 80% of.
Our total billable revenue for ambulance transports.
And what, the other portion is just written off?
Either written off or taken to collections. And 80% is actually a high amount.
High amount to collect for?
Yeah. What we're being told is usually about 70% is considered kind of like the acceptable standard.
Okay. Does anybody else have any other questions?
So the additional funds that would be brought in, where do they go exactly?
They would basically go back into the general fund. They would basically help to support operations.
Back into the city general fund.
Go back into the city general fund, but we do take a lot of that pool back into the community. We provide the MFR and EMT training that we do. We do the monthly CEs that we do. We have the exchange program that we swap with first responders. So there's a lot of that fees that basically gets carried back into the first responders. Not directly, but indirectly through the exchange of services. Because we don't charge them for continuing education if they use a nasal cannula, non-rebreather, any of those exchangeable, durable or disposable goods. We swap those with them on scene. So if they use a piece of equipment or item, we swap it out.
Really like to see the numbers, but it's just me.
I'll make the motion. We approve the 5.2 and the new transfer fee.
You don't need us for the other stuff.
Street no transport.
I don't believe so, because within the contract, anything under 5%, we can make that adjustment
Okay.
by the contract language with the ambulance contract.
Okay, so we have a motion by Commissioner Peterson.
I'll provide that second.
Francisco, any further discussion? Commissioner Osmer, you said and I know it's probably going to be would it be possible just to kind of, because I know by the time this will move forward to the full board, is there any, what is this? Yeah, full board. So is there any way that you could kind of generate some numbers before that? So you got 2 weeks or so?
Yeah, because I'm actually going to be at your next full board of commissioners to make a presentation on the service we provide.
Okay.
So I can get you that. If you can email me exactly what you want for numbers, what you're looking for, if somebody could, like it's Mary Catherine or whoever, I can get those.
Okay.
That would be fair.
Any other discussion?
Just one last question, I guess. I'm sorry. The individuals that you go to their homes to help get them from their home into their vehicle, vice versa, are these individuals, I guess you wouldn't know because we don't charge them whether or not they're actually insured or whether these are people in
don't
need?
know.
Okay.
We don't know. It's easier for us to take 10 minutes out of the day.
Right.
To help them in and out of the vehicle versus the about 35 to 45 minutes transporting them, generating the paperwork,
Right.
all of that. So and they really don't need an ambulance. So
Right.
the insurance is not going to cover it.
Okay.
So.
How are you notified? Do they just call or?
Yep.
Just feel bad because usually if they're calling.
They call the station, they say, hey, my mom needs help getting in and out of the vehicle on Monday, Wednesday, Friday to go to a orthopedic appointment for the next 2 weeks. Can you guys help her out?
You said in that case, is that where you would charge that or?
We could charge it, we don't charge it. That's what we call a patient assist. There's $175.
I thought you said something and there was some that you could actually charge, like if this was over a
Correct.
period of time.
Most of the time when we get it, we get 1 or 2 times that we get requested to help them in and out. But if it's going to be something, for instance, like a 6-week period, our billing company says that we can actually charge them that $175 twice a day for the 6 weeks.
And do you do that?
We don't. Currently, we do not.
So you don't charge anything even if it was 6 weeks?
No.
Okay.
Currently, we just do it as a service.
That's what you refer to as a lift assist?
Yeah, a patient assist.
Patient assist, sorry, excuse me.
Patient assist.
Okay.
And that's the plan right now going forward.
Going forward, we will continue that. And for us, it's in the city. So I'll give you an example. There was a client that we had that was out in Osneek that needed help getting from her house to the dial-a-ride. Sanborn Fire Department obliged her with that. In fact, it was recurring like 3-4 times a week for about 2 months. They actually went and bought a stair chair so that they could help her. We weren't needed. So they covered that on their own. So we do make those arrangements if they're outside the city, that the volunteers might have access that they can do it. It literally only takes about 10 minutes each time.
Okay.
Which means a great deal to them, so thank you.
Yeah.
So any further questions? Okay. So we'll do a roll call on this.
Commissioner Osmer?
Yes.
Commissioner Francisco?
Yes.
Commissioner Peterson?
Yes.
Commissioner Kozlowski?
Yes.
Thank you. All right, guys, and if you want to get it, however you want to handle that. I will get you guys some numbers. Not a problem at all. Thank you.
Oh, and then we move into the ambulance fund monthly report. Does anyone have any questions? Mary Catherine was going to supply all the answers on that one.
All of them, yes.
Receive and file.
I didn't, when I looked through, I don't think I saw anything. Let me just double check.
To me, that's an anomaly to anything.
Okay. We'll just receive and file the,
I'll make a motion to receive and file the ambulance reports.
who supported that?
I did.
Support by Commissioner Peterson. Any questions? All those in favor, say aye.
Aye.
Opposed? Okay. Next item. Medical, same thing, I guess, with the medical reports. Opportunity.
Read through both, so if nobody has an issue, I would be with making a motion that we receive and file both
Okay.
medical examiner and veterans support.
Oh, yep.
So I've read both those, and
Yeah.
pretty standard.
You good with that? And we got a motion to receive both the medical examiner's monthly report as well as the Veterans Affairs monthly report. If anyone, well, we have a motion. We have support?
I'll support.
Support? Does anybody have any questions regarding those?
I just have one discussion point. Since I'm the liaison to the Veterans Affairs, this is just a point of concern at this point that I'm going to just bring it to the committee's attention. I'm concerned the new chair at the last meeting didn't show. Several attempts to try to contact him went, he was unavailable, but now I found out after the meeting that apparently he wasn't aware that there was a meeting and he's the chair. So if this becomes a recurring issue, this is just kind of step one, if you will.
Are they scheduled the same time every month?
Every other month.
Oh, every
And they have the whole calendar for the whole year. So just a point of caution is I want to bring it to the committee's attention.
So
Because
were you at the meeting?
I was.
Did you step in?
The vice chair did.
Oh,
The vice chair did. They had barely a quorum, but they did have a quorum. So
okay.
just a little bit of a concern because, I mean, packets are emailed out a week before. So I don't know exactly what the cause was yet, but it was a point of concern and I just wanted to make sure the committee was aware. I will continue to attend those, and if it becomes a recurring issue, I'll bring it to the committee.
Okay. Any other comments, concerns? Okay, we have a motion to support, to receive and file both of those monthly reports. All those in favor, say aye.
Aye.
Opposed? Okay, oops. Other discussion. Okay, we're at the animal control program. Next steps discussion.
Right, so that's all this is just to see how the committee wanted to proceed. Since there's been a lot of discussion around this issue, obviously the survey is still live through the end of the month. So we'll continue to collect those responses and, once the survey is closed, we'll compile those and bring the responses back to the committee. One of the big questions that has been asked is kind of the financial situation, right? There's been a lot of discussion about it, a lot of different numbers back and forth. And as I've mentioned, one of the challenges is that we have figures for this budget that live in lots and lots of different places. Because kind of the way historically this program has been operated and changed in its operations, there's lots of different places where both the revenue and the expenses are carried. One of the things that isn't always clear when you pull up a report for what we call which the department, which is 430, which is ordinance enforcement, which actually there was a redo of the accounting standards, the general ledger for counties. 430 is actually specifically animal control ordinance. So we do need to move soil erosion out of this department into its own department, but we can handle that as part of the budgeting process for 2024. But for instance, dog licensing sales are not carried in 430. They are actually carried through the treasurer's department. And that's because the treasurer statutorily has the responsibility for collecting those fees. So right now, all of those revenues are carried in the treasurer's office department, as are the expenses, some of the expenses, right? So the printing expenses for printing the actual dog licenses, administrative costs for issuing those licenses, dealing with the veterinarian's offices, all of those are carried through the treasurer's office. Obviously, our ACO, which also functionally right now acts as our shelter manager, that salary is carried through the sheriff's department, as well as administrative costs, right, are carried through the sheriff's department because all of the budgeting, all of the expense tracking, all of the recording of donations, all of that is handled by the sheriff's office department right now. So those expenses are all, again, not carried in this 430 department. Then the other expenses that we've talked about are, for instance, utility costs for that building. Those costs are carried in our maintenance department. So trying to actually get a handle on what we actually both bring in terms of revenue and what we spend for the operations of animal control are a little bit of a moving target. But I was able to pull together an approximation of a 5-year look back. So I went back to 2017. And you can see in the report that I sent to you that this, even back to 2017, this was a program, a service that we are required to do that was a cost to the general fund, like any of our other services. This is something that the general fund carries as an expense. I don't know that there was ever an expectation that this should in some way cover itself, since this is a statutory service that we are required as part of the dog ordinance, the dog laws by the state of Michigan to do. Historically, the dog license sales have brought in somewhere between $25,000 and $35,000. It's gone as high as a little over $40,000 in some years, but historically.
Just one comment, 'cause I know Bill will remember this, that we had Michelle come in to us and say that if we gave her that $6,000 to send out the mass mailings, we could potentially bring in up to $300,000 that year in dog licenses, which would mean we actually have more dogs in Alpena County than we do people. So just, when I was going through my notes and stuff, I put a little note on that, but anyway.
And that would be one task that we could do, would be to reach out to some of our neighboring counties or some similarly sized counties and say, all right, what do you generally see in terms of revenue? Are we batting about even? Are we under? Are we over? And what's generally the percentage that you can reasonably expect to bring in terms of dog licenses? If we think that there are, let's use a round number. If we think that there are 10,000 dogs in the county of Alpena, of those 10,000 dogs, how many can we reasonably expect where their owners will come in and license them? I would imagine that, MDARD might even have some of those numbers for us statistically. There are, because the treasurers have a program that tracks dog license sales. So that could be one next step as far as our data gathering to figure that out and say, are we about right where we should be with revenue? Should we be expecting to bring in more? Should we be expecting to bring in less? But one interesting thing that I did note is once you kind of pull in all of these numbers, that yes, we have seen a steady increase in the cost to the general fund over the past 5 years of this program. But it didn't jump sharply in kind of the way I anticipated. I thought that in 2019, which was the last year that we had a contract with HHS, that we would see a big jump. But there was an increase, but it wasn't quite to the level at which I expected. You can see that the general fund has contributed somewhere between $20,000 and $35,000 to the operations overall of animal control. So the other documents that I sent you were kind of just some philosophical thoughts about ways that you could proceed forward. I don't know if you want to, kind of talk about these, if you want to digest these a little bit more.
Just have one, so on this budget, you have like highlight, or not highlighted, but different colors, like the blue and then whatever that color is, brownish.
Yep.
What was the difference between your blue and your brown?
So the blue are expenses that are carried in the treasurer's office, and then the red are other. So there's some that's the sheriff and some that are the facilities, maintenance.
And one of the things, and I know, because I had mentioned something in Wes, actually, I remember you were talking about, you said you don't have the ability to get the gas charges for the building, or you do?
I do, I gave.
They're in there, they're in the utilities, they're in
I
the,
have water and I did get those. I did not get,
It's gas.
I didn't get the gas, and the electric, I don't think we can pull out, right?
Separate.
Can, but
Right.
you should. On my part, maybe I just didn't give you copies of them, but I have them on my desk.
Do you know, I mean, what, is it a huge amount, or is it?
$4,000 or $5,000, I think gas was, if I'm not mistaken, total.
What I have is both water.
Let me ask you this.
Probably got both gases.
Okay. I have 2 copies of water, but I don't have the gas. So that's easy to plug in. And, like Wes said, that's not a huge number. But I will say the water, that water sewer bill has jumped pretty dramatically. I mean, we've gone from, $200 in 2018 to almost $1,000 in 2022. So that, and obviously that's not a surprise, right? The building is getting a lot more use than it had before. So that's not a mystery.
Well, the other piece, and I know, I think I had mentioned it to you before, though, with the merchants building, when they were using that, obviously if we're heating that, I don't know what the temperature is normally in there, is it?
Normally don't heat it at all.
So during the use of those animals being in there, which I don't know how long that was.
Should re-speak, because when you heat the merchant's building, you're heating our shop. So our shop is heated all winter long.
So some of it will trickle over. That would be a hard number to get a hold of because it's for a discrete period of time, it might be between billing periods, but yes. So I will say, in terms of pulling these together, I do think it brings up an issue that is, just something to think about, which I hadn't really kind of conceptualized previously, was we have enforcement, right? Because we have an ordinance that we are required to enforce. And that's one of the things that has changed from the start when 2017 to now. Actually before, because I think 2017, and the sheriff maybe could answer this question, there was an ACO officer.
Michelle came on, I believe, either 2017, because I remember the former sheriff talking about hiring a vet tech to be the ACO.
To specifically be an ACO. So there is both the enforcement piece, because we have an ordinance that we have to enforce, but the ordinance enforcement could be civilian. And I know that historically, and that probably going back a number of years, that was a civilian position. I am not going to opine about, but maybe that's something that this committee could have some discussion about, the relative merits between having a civilian enforcement officer and a law enforcement officer. What I will say, I did do criminal law for just a small fraction of my career. Having somebody who has the ability to write, both the civil infraction as well as other, misdemeanor and even felony charges probably is advantageous. But you have the ordinance enforcement piece, you have the enforcement piece, and then you have running the shelter piece. And there are certain categories of animals that are going to naturally come through the county and are going to be property of the county for a certain amount of time based on how long it takes to adjudicate or deal with a case. So there's always going to be a need for some type of way in which the county has control and the responsibility for certain groups of animals, whether that's just dogs or whether the county wants to think about rewriting their ordinance so that there are other groups of animals that we might also take care and custody and control of based on law enforcement or civil infraction or ordinance enforcement things. But I think one way to conceptualize this might be to separate out the ordinance enforcement piece, the enforcement piece from the shelter management piece. And it might be cleaner for budgeting too, if we like say, all right, the enforcement piece, that's the sheriff's department, or that's a law enforcement piece. The shelter management, maybe that's not. It may be one way to have a conversation about this moving forward. I am not making a recommendation. I am just throwing things out for thought. And certainly not asking for any kind of a decision today. I am looking for direction from you guys about if there's other information you would like me to gather, other scenarios you'd like me to pull together. If you would like to, set up some further discussions, some further meetings, and obviously until we get the rest of the survey information back in, we had said we would look for some public input, and so that's our public input.
That's our public input. Good.
So one of the questions that I had going through this, and I don't know where, because I was looking at comparing the numbers, under the expenditures for ACO deputy in 2017, was that because that wasn't a complete full year, or?
I believe so,
That's quite a, and then
Right.
where we are today, there's a big difference there.
There is, and honestly, John, Chair, I don't know the answer to that question since I wasn't here in 2017. All I did was pull a report and plug in the number.
And then the other piece to that is down the bottom where you have the Huron Humane Society for 2017 was 13, and then 18, 13, 595. What was that? Was that the contract with Humane Society? Because we actually paid 17.5, I believe, in 18.
Right, and I was not able to circle back around to Treasurer Ludlow. She and I had some conversations about where I could find that information. And since it took me a lot longer to get to this task than I had been hoping, I was not able to ask her that question. So what I did was I found where that contract was in the budget as an expense line item, and I pulled that actual cost across for this report. What I really need to do is pull an accounts payable report so that I can actually see the invoices that were paid to Huron Humane Society, because it might be that there were additional costs that weren't part of just the base contract.
We had a monthly, we would pay them monthly for the services.
So this is definitely a working document. I am still sussing out some of the details on it. And it had been on my list to reach out to the sheriff's department to work with their admin person out there to see if I could answer some of the specific questions that I had. And she and I are now going to meet on Thursday to go through some of the sort of more specific detailed questions. Because one of the things, of course, in trying to build out a projection, a go forward budget, is trying to suss out, as opposed to everything just kind of being in one line, what do we spend for the care of animals? What do we spend on food? What do we spend on medications? What do we spend on veterinarian expenses, mortuary services, so that, we can have a better sense of what the operating budget is. And so that's the meeting I'm hoping to get. I will have set time up with her to get that more detailed information.
Once we have that detailed, and for the record, I see there's 4 things that we need to take a look at with some caveats. Do we maintain the status quo, continue to operate the control shelter under the management of the sheriff's office, sheriff's department? do we continue to operate the control shelter under a different county department? Do we look at other options besides, again, the enforcement piece? We know where that's going to stay. But the shelter operation, does it go to a different county department? Something to consider. If we retained it under county responsibility, do we continue with the current shelter facility that we have, or do we look at a different facility in a different location? Because, I mean, the one that we have at times is satisfactory, but there have been some questions about, is it really the right building anymore because of it's an older building and we have kennels and some walking areas built outside, and it's at the fairgrounds, which at times causes some concerns. Or does the county actively pursue a contract with a non-governmental organization with a newer, larger or whatever facility? I mean, I'm not advocating any of those, but I think we have to at least consider those and discuss those for the future.
Well, I know one of the things, and I mentioned it to Mary Catherine, we went back in February 10th, we had a meeting with the ACO. And at that meeting, we were trying to get an idea from her on ways we could move forward to, I guess, better serve. And this thing has kind of gotten, to me, it's gotten out of hand because, when and again, I don't think anybody's intention back in February 10th was to change something dramatically, but yet I see people send me stuff on how supposedly we're moving forward to eliminate certain things, which I have never heard that from anybody's mouth. I know Mary Catherine was commented or quoted in the paper, but that's the reality. We can do nothing, like you just said, contract out a portion or contract it all out. I mean, that's the reality. And other than that, it's not, we've never said we are doing something. I even told Mary Catherine, I told Michelle at that time that we weren't making any changes. And if any changes were to happen, they're 9 months, probably next year, that before we even make those. But one of the points that I wanted to make was that we literally had asked her how she could work with us to move forward with this. And the first thing that she said was, we need a 501(c) for the animal control shelter. And I specifically said, that's not what we need. I don't feel like we need another 501(c). 501, did I say that right?
501(c)(3), you guys got it?
Okay. But I said, we need to figure out, we already have two. We need to figure out a way that they could work with us somehow. And yet, I think it was 3 days later, they filed for Friends of the Alpena. And again, I know she's not going to say it was her, but, she brought it to us. So a 501(c), C3? I can't say that. I'm not going to say it again. Was filed for the Friends. And I don't know if to date we have received any, because at that same meeting, February 10th, we asked for best practices for an animal shelter, because she had mentioned to us that her shelter follows best practices, and we've not received anything. Mary Catherine?
I have not received any operating procedurals or policies
Okay.
for the shelter.
So, it's not like we just asked her last week. This is February 10th, and here we are, March or May 15th. So we're quite a ways down the road. I would still welcome any of those procedures that she has, because she indicated back in February that they've been told that they have the best policies and procedures for running an animal shelter. So I would suggest that if we could get those, I'm still willing to see them, because I would love to see what those policies and procedures are. But as far as this budget and what we do next, or not really budget, but the proposals that we have here, I think that what we need to do is see what the outcome of the survey is, and then, again, I don't think any of us are here to rush through this process. We're trying to figure out what the best options are for the animal control and the county as well.
Sort of based on the discussion up to this point, I have.
I'm sorry.
Is there any additional information that you would like me to attempt to gather, to reach out for? Just the rest of the, yes, I guess.
Whether it's water, gas, sewer.
Okay.
Oh, yeah, no, I would agree. I mean, so far, we've been told that we're asleep, we hate puppies, and we're dumb for trying to find cost-saving measures or good reforms. But I guess how it goes, would it be possible? I mean, we've asked nicely, I think, numerous times, and here we are, because I hearing us talk about asking for these policies or practices for a while. Can we compel them by a motion, asking for them to be presented before the next meeting of this body?
Well, I mean, I believe she said she had them.
Well, I would make a motion that they be presented to this committee before the next meeting.
Okay, we have a motion and I'll support that motion. Any discussion?
I would just like to say that the reason I'm asking for that and demanding it is we have been told by many people through emails and whatnot that we're not taking everything into consideration. How can we possibly take everything into consideration if we don't have the very procedures and policies that we're being told are golden to evaluate?
Yeah.
It doesn't make sense. And while we're looking at numbers, we should also look at the practices and maybe they do make sense, but it's completely unfair for us to assume that they're great without being able to view them ourselves. So I just want to clarify.
And with those, again, I agree with Commissioner Asper. And then we look at, okay, again, different courses of action. What are the options that we have? And then to the best of our ability, evaluate those different options and what provides, what meets the end state of taking care of the control of the animals that are required by statute, and doing it in the best and most cost-effective manner. And so we have to evaluate those different options and come up with our best decision.
And again, I don't think anybody here has said that we need a decision by next month. So we'll continue to see what we come up with information, and then go from there.
Yeah, I just thought it would be helpful when we get the results back to also have this as well. It'll just give us a lot.
By our next meeting, we'll be able to have that as well.
Right.
So,
Yeah, because the
Okay.
survey should be closed, so I'll be able to get you summaries of all that information.
so motion and support. So any further discussion? If not, all those in favor, say aye.
Aye.
Opposed? Okay. I don't know if there's any further discussion on this, or are we good to move on? What's next? Okay.
Next
Are you
meeting.
proposing? Next meeting is June 19th. I don't know what. Okay,
Juneteenth?
oh, that's right. It's a holiday.
Well, no.
No.
It's not a county holiday.
County holiday.
And then your calendar is a holiday.
It is.
Oh, you work for the government though.
Yeah. Juneteenth, it's a holiday. It's red on my calendar. Okay, never mind.
Make a motion, we adjourn.
Okay, motion to adjourn, support. All those in favor, say aye.
Aye.